Okay, so this presentation kind of tacks on to the priority of the very first test taking strategy presentation that I've done. So has anybody not seen my original test taking strategies presentation? So a couple of you. So I'll take my time when I go through just the intro of what this is, and then whoever hasn't gotten, so when you are done, just remind me and I'll email you the original presentation so you have it. And I think the 440, are you in 445 as well?
Mm-hmm.
I think some of the 445 instructors have posted it under resources, actually, in the resource tab. So basically this is just a PowerPoint to figure out who do I see first, who's the priority patient, who should be put with the most experienced nurse. So we'll just get along. So I've kind of created this little spectrum. So the piece of paper that I've handed you, it goes that top line from chronic to acute. So let's say you're looking at a question and you want to know who is the priority patient. Think to yourself, do they have a chronic situation or is it an acute situation? The second thing, is it a non-urgent situation or is it an urgent situation? And then the last one is, are they stable or are they unstable? The goal of this is to look at each answer option and place them on a spectrum for each of these categories. And as we go through it, it'll make a little bit more sense. So whichever answer has the most to the farthest right will be that priority patient that you should see first. And then an important thing to remember in this type of a question is, are they giving you somebody that has an actual problem or somebody that has a hypothetical or a potential problem? And as we go through the very first question, we hit on this a little bit. So it's just something to keep in the back of your mind. Are they saying that patient A is short of breath versus patient B, who you just have a set of vital signs that the respirations are 25? So I have a potential issue where maybe that patient that's just a set of vital signs ran down the hall and then your CNA came in right after they came back into their room and they took vitals and they're like just calming down, versus patient A who literally it says they're short of breath, that is an actual problem. So in these, just kind of think to yourself, do they have a real problem that's stated, or are they kind of hinting that maybe there's a problem? So go with the actual problem if there is one. So in my first test taking presentation, I kind of set up this scenario of priority. So I have it categorized as far as ABCs, then pain, then education, well-being, feelings, coping, and normal findings. So in the original PowerPoint, let's say option A said your patient is short of breath. That's an airway breathing issue, so that would go in the farthest left category. If it said you're going to teach your patient about something, that would be in the far right category. So in terms of priority, I don't really care about what's on the right-hand side. I care about airway the most, then breathing, then circulation. For the first presentation, I tack on an apostrophe S. So that takes like Maslow's hierarchy of needs, that safety aspect, and adds it onto priority. So as we're going through, I'll make sure that I do take time for those people that haven't seen this yet to make sure that I explain it. Because sometimes when I go through this, this is the first time I've done this. So I'm just kind of making sure that everybody knows what I'm talking about. I don't want to breeze through it too fast. So that's just saying everything we just talked about. Okay, so let's try a question. And it's interactive too. So. Nurse on a medical floor is caring for clients diagnosed with AIDS. Which client should be seen first? So which client should be seen first is getting you to think who's the priority patient. The client who has flushed, warm skin with tented turgor. Does anybody have any thoughts on that person? What's dehydration? They're kind of getting you to think, okay, they're tented. That's the key there that makes you think dehydration. Plus they're flushed and warm. So they have an actual problem, right? So just keep that. That's where the actual versus potential comes into play. So does this person have a chronic problem or an acute problem? Acute. So I'm just going to write number 1 here on the acute side. Okay. Are they non-urgent or are they urgent? They're pretty urgent because they're dehydrated and they're warm and they're flushed and they're tented, right? And are they stable or are they unstable?
Unstable.
Unstable, because you're knowing that tenting means that they're dehydrated plus all of those other things. So let's see what the next one is. The client who states the staff ignores the call light. Is that a chronic or acute thing? We don't really know because it doesn't give us any more information than that they're ignoring the call light. So to me, when I read something like that, I am gonna say, I don't know, maybe yes, maybe no. So I'm just gonna place number 2 closer to the middle because it doesn't tell me right off the bat. So is it urgent or non-urgent? At this point, we don't know. So I'm gonna put that in the middle. As far as stable and unstable, again, we don't know. We're not gonna assume. It could be that she really has an urgent issue, but it's not, you don't ever wanna read into an NCLEX question. So at this point, we just don't really know for sure what the problem is. The client whose vital signs are a temperature of 99.9 Fahrenheit, a pulse of 101, respirations of 26, and a blood pressure of 110/68. So there's some borderline vitals right there. So to me, this 99.9, they consider that fine. Very, very, very minor. This is very, very borderline, and this is borderline. The one that concerns me is this right here. So in terms of chronic and acute, where would you place this on the spectrum of chronic and acute? An acute side. Is it more acute than this patient that has a definitive problem?
No.
I would say no, because we don't want to assume. So we'll just put it right there for now. Is it a non-urgent or an urgent issue? It's probably urgent. Is it more urgent than number 1? Probably not. We don't know until we assess them though. So stable versus unstable. I would say they're more on the unstable side because you don't know. You don't want to assume, but if they have vital signs that are borderline all over the place and then one that's for sure, I would say they are on the unstable side. But again, I want you to keep thinking, is there a definitive versus a hypothetical problem, or a probable and a hypothetical? And then number 4, the client who is unable to produce a sputum culture. Is that a chronic or an acute issue? Why would you need to do a sputum culture in the first place? What are we looking for? Infection. Infection. So is infection acute or chronic? Usually acute when you're in the hospital for it. So you kind of have to decide in this situation, where on that acute spectrum do you want me to put it?
Between 2 and 3.
Between 2 and 3? I would agree with that. So I'm just going to put 4 right there. What about urgent, non-urgent? You pretty much know that you want to pick number 1 at this point because you've run through the gamut of possibilities. So what about stable, unstable? I would say they're pretty stable. I mean, in terms of, maybe you could put it midline, but. So at this point, I would just say, okay, well, number 1 is farthest to the right. I probably would go with that. What I want to do is do this exact same question with the old style of priority, so you can see that you can use both, and they work a little bit differently. So in this instance, it's just going to run through and show you kind of when I made the PowerPoint up where I would have placed them. So 3 still is on that same side, and then 4. So you guys, with what you were saying, was pretty right on key with what I was thinking. Number 1 is the correct response. The patient is dehydrated, which you said right off the bat. And this is an actual problem, not a potential problem. And that's something to definitely think about as you're going through who is the priority patient. Are they telling you there's an actual problem going on? So this is the same question. We're just going to do it this way. So the nurse on the med floor is caring for that same patient. Who do you see first? So the client who has flushed, warm skin with tented turgor. Is that an airway, breathing, circulation, safety, pain, or education, coping, well-being issue?
ABCs.
What part of the ABCs would you put that?
Circulation.
Circulation. So I'll put number 1 above the C there. So the client who states the staff ignores the call light. I would put it all the way in that category. So I know right off the bat, I'm not going to pick number 2 because I've got something all the way in the circulation category. The client whose vital signs are 99 Fahrenheit, 101 pulse, 26 respirations, blood pressure of 110/68.
ABCs.
ABCs. I would even put this in the breathing category because the respirations are 26 if we're gonna be honest about it. So I'll put 3 there. And then the client who's unable to produce a sputum culture. Where would you put that one? It could go, and if there's already something on a category, you could put it there too. Sputum culture. I would say at least safety, because safety's infection. But if I can't cough up something, I might even want to put it in the breathing category. Even though it's not talking about breathing, I could probably argue to my teacher, it could be in the breathing category. But in this instance, I probably would feel safe putting it in the safety category, because safety, when we talk as far as strategy goes, safety can mean physical safety or anything to do with infection. So if you were to do it this way and not have that other strategy in your back pocket, it would look like number 3 is the right answer. But the answer is dehydration, which, because you have the tenting and the warm skin and the flushed skin, because it's an actual problem, not a potential problem. So I like to do it both ways so you can see if you're stuck on one way, try and think of that spectrum here. So we'll do another one. All right, the charge nurse is making shift assignments for the medical floor. Which client should be assigned to the most experienced nurse? So who's the priority patient? The client diagnosed with congestive heart failure who is being discharged home in the morning. Chronic or acute?
Chronic.
Chronic, because congestive heart failure is chronic, so. Urgent or non-urgent?
Non-urgent.
Why is it non-urgent?
Discharge.
They're being discharged.
They're stable enough to go home, which I just kind of give you the next answer. They're stable enough to go home. So I would say, what if though I said the client diagnosed with congestive heart failure who is just being admitted to the floor? That changes things, right? That would be chronic, urgent, unstable, because they're just newly being admitted. The client who is having frequent incontinent liquid bowel movements and vomiting. Acute or chronic?
Acute.
Non-urgent or urgent? Stable, unstable? Client with an apical pulse of 116, respirations of 26, and a blood pressure of 94/62. Acute or chronic? More than number 2 or less than number 2? More. Because these are grossly abnormal, all 3 of them. I would say this patient's got something going on. So these technically could be the vital signs for number 2, right? Non-urgent or urgent?
Urgent.
More than number 2?
Yes.
Stable or unstable? Unstable. Anything more than number 2? Number 4, the client who is complaining of chest pain with inspiration and a non-productive cough. Where do you want me to put that on the spectrum? Before the 2. What about the next line? Same spot?
Mhm.
What about the last one? Same thing?
Yeah.
Just, and the reason I put in all my updates on Sakai upper division nursing is because if you haven't learned this content, you have absolutely no idea. But what does that sound like? Is that a cardiac or a respiratory issue? And, yeah, so usually maybe like pleuritis, maybe pneumonia, that type of thing. So that's why it's important to kind of think through that. So let's see where the original ones are. So everything was on the left for that one. All right. So in my opinion, I kind of felt like this one was more important than that one, just because it had the respiratory aspect to it. But either way you shake it, number 3 was farthest to the right. Let's do it this way. Client diagnosed with congestive heart failure who's being discharged in the morning, what category do you want me to put that in?
Education.
Client who's having frequent and continent liquid bowel movements and vomiting. Circulation. Apical pulse 116, respirations 26, and blood pressure in the category.
Safety.
Maybe.
I probably would put it at least in breathing. I probably, because of the high respirations, I always like to be devil's advocate and put it to the highest area so you can see how it really works. Chest pain, inspiration, non-productive cough. So somebody said safety. What else? Anybody else have any thoughts on that?
Airway.
I would say
Breathing.
at least breathing, I would think. So with this one, you've got a tie on the breathing category.
Mhm.
So you kind of have to think through that. So let's see if we put the same thing. So you guys were staying on track with my thoughts. So because respirations are elevated 3, that's why we put it in the B category. As a general rule, an actual circulation problem beats a hypothetical circulation problem. And number 4 is describing pleuritis or maybe pneumonia. Another one. Nurse on the rehab units caring for the following clients. Which client should the nurse assess first after receiving the change of shift report? So who is the priority patient? The client with a C6, so cervical 6, spinal cord injury, who is complaining of shortness of breath and crackles in the lungs. Yeah. 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 Okay, so a lumbar spinal cord injury who is crying and very upset about being discharged home. Now that you got this thinking right, so it is, they do have a lumbar fracture, so we could even say that it's still kind of on the acute side since it's a fracture, but it's, in terms of everything else, they're being sent home. I would say maybe if, I could even argue of moving this a little bit more on the unstable side if they're crying.
Mhm.
You might want to address that at some point sooner rather than later. Client with a lumbar spinal cord injury who is complaining of a headache and feeling very hot.
Acute.
More than number 1?
No.
No?
Between
What about that next line? Where? You want me to put that one? I know what you're thinking. You know that that's bad.
Yeah.
You just have to kind of use that nursing judgment. Is it more urgent or less urgent than number 1?
He doesn't have breathing problems yet.
So I would say,
I would still put 1 before
Yeah.
3.
Okay. Stable, unstable. And where do you want me to put it?
unstable.
Before or after? I don't know, like this report or something like that.
Yeah.
So, tell me where to put it. I already know the answer. I'm not gonna put it.
Put in the same spot.
Yeah.
Same as 3?
Yeah.
Okay, same as the other one. Okay. Go with your gut. So, thoracic injury who is unable to move the lower extremities. Chronic. I mean, that's an expected finding, really. So just keep it, you're good with over here? We know that it's at least number 1 or number 3, right?
Mm-hmm.
So would you have gone with number 1 versus number 3? If you didn't think of this process? Yeah, you probably would have done that. Good. So let's see where we got. So really similar spots. Good. So 1 and 3 are both urgent. With something like this, go with the ABC's rule. Hands down. So this, when you combine this question with this strategy, things become a little bit clearer. So where would you put that one? Yeah. Lumbar, crying and upset about being discharged home. L2, who is complaining of a headache and feeling very hot.
ABC.
I would say C for sure.